After you've successfully passed the tube, there are several things that should be done to ensure successful post-intubation care. To begin, verify placement while holding the tube secure. Listen for breath sounds while you bag the patient, and look for color change on the colorimetric CO2 changer, or check the monitor for an appropriate end tidal CO2, which is around 30. Second, check your tube depth and secure the tube. Remember, the depth should be about 3 times the tube size, about 22 centimeters for a 7/0 tube. Then, place an OG tube and set it to low intermittent suction. Now, you can elevate the head of bed to 30 degrees to help minimize the aspiration risk. It is best to then spend some time with the RT by the ventilator. There are a few small things that make a big difference in patient outcomes. Tidal volume should be about 6 cc's per kilo of ideal body weight. Have the RT measure the height of the patient. Assess the minute ventilation of the patient prior to intubation and set the respiratory rate to match it. Remember that minute ventilation is respiratory rate times tidal volume. For normal adult physiology, the respiratory rate should be between 12 to 14. Titrate the FiO2 to less than 60% when possible to an appropriate SpO2 that's acceptable, around 94%, and possibly lower for those with asthma or COPD. And then ask for an ABG about 30 minutes after intubation to help adjust vent settings accordingly. Last but certainly not least, please remember to make the patient comfortable and potentially place soft restraints on the hands. If using propofol for sedation, remember that this does not treat pain, and you will likely require the addition of an opioid medication. With all that, you can provide safe post-intubation care for every patient, every time.